According to the World Health Organization, headaches are the most common disorders of the nervous system. It is estimated that between 2 to 4% of the adult population will suffer with 15 or more headaches a month. As a result of the pain, it often leads to strained family, social, and employment relationships. Most people who suffer with serious, disabling headaches are left to choose between the many different medications to treat them. However, others are now discovering a drug-free approach that has proven to decrease the frequency and intensity, and in many cases stop the headaches by getting to the cause of the problem. In my 22 years of practice, I've been able to help people who have suffered with all types of headaches, including cluster, sinus, tension, rebound, chronic progressive or traction headaches, hormone, dental, and migraine headaches as well. The reason I'm able to get results where others have failed is due to my postgraduate training in chiropractic neurology, functional endocrinology, brain-based therapies, and nutrition. Let's go through a brief description of some of the more common headaches. Cluster headaches are more common in men, usually over the age of 20. These are considered the most painful of all the headaches. Severe pain around the eye with tearing and redness along with the sinus on that side will give them a great deal of discomfort. Many people describe this as if it were, let's say, a hot red poker being shoved through their eye. These headaches will frequently reoccur in a pattern or a cluster. That's how they get their name. And these clusters can occur for weeks or months at a time, and then they'll get a period of maybe weeks or months with no headaches at all. So those are the cluster headaches. Tension headaches are one of the more common ones, and they begin as early as in the teenage years. They will occur with slightly more often, let's say, in females than males, and these can last from a few hours to several days. It is best described as a feeling as if a person were wearing an extremely tight headband. The tightness can sometimes radiate into the neck or actually start in the neck itself. Now, the other headache that I want to talk about are migraine headaches. And migraine headaches are thought to involve the brain, the nerves, and blood vessels of the head. The pain tends to range between moderate and severe, affecting just usually one side of the head. The pulsating pain can last from hours to days, and nausea often accompanies migraines. These are recurrent headaches that will often begin at puberty and will often last a lifetime. The problem as I see it is twofold. It comes down to this. Is what you are doing truly helping, and or are you concerned with the side effects of the medications? Because what I'm hearing from people who suffer with chronic headaches are things like, I'm not sure that these drugs are making that much of a difference, or it helps to take the edge off, but I still get them and I'm concerned about the side effects of the medications. In helping people who suffer with chronic headaches, I found that by assessing the neurological, structural, and metabolic components has allowed the greatest success. If there's a structural or a neurological component, then chiropractic and chiropractic neurology techniques, as well as brain-based therapies, are available to get to the cause. If there's a metabolic component that needs to be addressed, then dietary changes along with specific nutritional supplements will be of great value. My recommendation is that you call my office to set up a free consultation so that you can explain your case to me, ask any questions you have, and I'll explain how we can determine if this type of care is best suited for you.